We are very proud of the rich history of living kidney donation at New York Presbyterian Hospital, Weill Cornell Medical Center. Our first living donor kidney transplant occurred in 1963 and was the first kidney transplant performed in New York. In the first 30 years of the program's history, 500 people served as living kidney donors. In 1998, we began to offer hand-assisted laparoscopic donor nephrectomy as an alternative to open nephrectomy, followed by a purely laparoscopic approach beginning in the year 2000, which represented improvement in donor recovery. In 2003, we began to expand opportunities for transplant by offering positive cross-match transplantation utilizing a desensitization protocol. And by 2005, we had performed 1,000 donor nephrectomies, showing the increased pace of living donation in the prior decade. 2007 marked the beginning of our blood type incompatible program, further increasing opportunities for transplantation. And in 2008, we participated in our first kidney paired donation experience involving a transplant chain kicked off by an altruistic donor. In 2009, we performed the first single-site donor nephrectomy at our center in attempts to further improve donor recovery. And that year, our living donor kidney transplant program was the second largest in the United States. By 2010, we had performed our 1,500th living donor transplant, having performed 500 procedures in just 5 years. In 2011, we began a clinical trial to compare single-site donor nephrectomy to conventional procedure in order to assess improvement in donor recovery. 2011 also marked the foundation and launch of the Living Donor Kidney Center at New York Presbyterian Weill Cornell. The center's goal is to empower people to make educated decisions about living donation and to educate the public about living donation.